Good day, my dear budding postgraduate students. I've already welcomed you to the wonderful world of pathology. And we shall be continuing with histology for pathology. And the class today shall be on esophagus and stomach. Now this is a cut surface of the esophagus. Any of these organs, we should be able to appreciate the multiple layers, the lumen, as well as the configuration of each. Here, we are able to make out the epithelium. So the innermost is the epithelium. Secondly, there is a lamina propria, which is actually supporting the epithelium. There will be a thin band of muscle, which is called the muscularis propria. So all these come under the mucosa. Epithelium, lamina propria, muscularis, mucosa. Further to this, there will be a submucosa. Submucosa is just below the mucosa. More important shall be the muscular layers. There will be, always remember this, inner circular, outer longitudinal. So this is an inner circular. When I see it under the microscope, they will be looking like linear strands. The outer longitudinal, on the other hand, will be appearing like cut surface because they are along the esophagus. And finally, look at this point over here. There will be a loose connective tissue. One or two capillaries I can see. Here again, a loose connective tissue that is called the advent or the serous. So this shall be the backbone of your histology of the gastrointestinal tract, a fundamental one. Now in this, I would like you people to identify. Let us forget the picture as such. Are we able to see the mucosa, the submucosa, smooth muscle, which is the inner circular and the outer longitudinal, and the serous? Of course, I can see the mucosa over here. There will be a lamina propria and the muscularis. And lower down, this is the submucosa over here. It has also got some glands. Coming to the muscle, there will be an inner circular. So I am finding linear strands, outer longitudinal. The serosa is not found in this picture. So this is a bird's eye view, a beautiful picture. And it is a kind of replication of the first. Mucosa, lamina propria, muscularis mucosa. Then there is a submucosa over here, the two layers of muscle or the two bundles of muscle, inner circular, outer longitudinal. At this magnification, I will be able to appreciate the different zones. Whereas here, it is a higher magnification, wherein I am able to see the stratified squamous epithelium very clearly. And what are these dots? They are all the nuclei. The nuclei and the cytoplasm is somewhat a mixture of eosinophilic and basophilic. We call it amphophilic. The cell membranes are not made out. I am able to see the distance between the two adjoining nuclei as the size of the cells. So this is the epithelium. And what kind of an epithelium is it? It is a stratified squamous epithelium. Lamina propria, then the muscularis mucosa, submucosa. So this is the esophagus over here. It goes a little bit below the diaphragm, and then the stomach is seen. In fact, this region of the diaphragm can act as a sphincter. Perfection is not mandatory for pathologists. If you are an anatomist or a surgeon, probably they will be needed. We can be a little crude to some extent. So on the inner lining, I'll be able to see the squamous epithelium. And lower down is the stomach. We shall see it later. And this is the gastro-esophageal junction. This is a more artistic view of it. I am able to find the mucosal folds over here. And the same story. There will be an inner circular, outer longitudinal layer of muscle. Now look at this one. There is a sphincter over here. Sphincter means it is a kind of a valve. It is a functional one. I am not able to see a structure. So whenever you swallow the food and then it reaches the stomach, there is a kind of constriction of it. When it is going to be incomplete, there can be a gastroesophageal reflux. The other structures you people can go through. So to some extent only we need to know. And this is a beautiful diagrammatic picture, courtesy Golet, Canada. Stratified squamous epithelium, but in your real slide, you will not be seeing this black cell membranes. This is the nucleus and the cytoplasm. Lower down, there can be the muscularis mucosa. Look at this thin band. And still lower, there will be the dense muscularis propria, inner circular, outer longitudinal. There can be the blood vessels, nerves, and other things. We need not go into the finer details. And externally, there is a loose supporting stroma called the advant. So again, a beautiful picture. I would like you people to describe it. The eyes see only what the mind knows. So there is some kind of a structure which can be a duct or some of the glands which are lower. Whenever there is a gland, there has to be a duct to deliver the material. And this is the lamina propria, etc. This is again a schematic picture. Whenever such pictures and too many names are, we need not bother about it. Let us see what best I can make out of. So I am able to see the squamous epithelium, and then there is the stomach. In the stomach, there is the gastric pit, which is over there, and later on, there can be the gastric glands lower down. Sometimes there can be the other special cells which are seen, such as the parietal cells. This, of course, is the supporting lamina propria. And look at the thin muscularis mucosa. And lower down, there will be the muscular layer. I hope this concept is clear for you people. We have done away with the esophagus. Now we shall go to the next one. So this is the fundamental that you people should remember. As I had mentioned, mucosa, submucosa, muscularis, and then the serous. These things you people can be remembering. The finer things that as the neural plexus, we shall search and find out, or I shall be teaching you them later on. So this is the next region, the stomach. Look at the contrast between the esophagus and this. Here, obviously, you will understand that there are a lot of these crypts or pits that are over there. And these circular lumina are all glands. And there can be the submucosal glands that I can see. There is a muscularis propria. So whenever we find any lesion, it is important that it crosses this particular region. There is a loose supporting tissue and then the submucosa is over there. Later on, there can be the muscularis. Look at this concept very clearly made. So there is a lining epithelium, glands. However complex is it, this is a concept. Then there is a supporting tissue called the lamina, thin muscularis mucosa. Below the mucosa, there will be a submucosa. Then, as I told you, there can be inner circular. Inner to the lumen, there will be a circular. Outer to it, there is a longitudinal muscle. Serosa is the outermost. It is important because it will be carrying the blood vessels and other drainage material. This is a fantastic picture just to show you the importance of it. In our class on peptic ulcer, which I have covered, I have touched upon it, you shall go. So these are the mucous folds which I can make. And then there will be the two layers of the muscles that I can make, the greater curvature, etc. Look at this muscular. There can be the outer longitudinal, and then there can be an inner circular that is made of. So circular inside, longitudinal. There can also be something called as oblique. See, these are all more diagonal. So muscles we have seen, mucosa we have seen. The rest of it, it is under the microscope. Look at this. Again, the gastric mucosa. These tall cells are called the foveolar lining epithelium. And the depressions are called the crypts. Lower down, there will be the glands. And the supporting one will be the lamina propria. There can be, look at these somewhat undifferentiated cells, small round cells. They are the neuroendocrine cells. So in the mucosa itself, I got so much to identify. Look at it, take your time, and then try to unravel them one by one. The same thing. The gastric crypt or the pit. See, there is a lumen that is superior on the surface. Then there is a gastric pit. Sometimes it can be branching. There can be specialized cells called the parietal cells. There will be a mucus secretion from the glands which is delivered to the surface. So these cells are the foveolar cells. Sometimes I can find basket-like cells called the goblet cells which help in secretion. I hope it is clear for you. The surface, tall columnar cells, sometimes there can be pseudostratification. Lower down, there will be the mucous glands. They are all supported by, look at this pale structure, they are all the stromal cells, and lymphocytes and plasma cells can be seen through. Immediately below the mucosa, there is a muscularis, then a submucosa. I don't think things can be made easier. So the same thing, I showed you the muscular structure. So there is a gastric crypt or a pit. Sometimes it can undergo a branching. Lower down, there will be more undifferentiated cells. That is, they are more immature. Higher up, they become mature. And there can be the other specialized cells over here. And this again is the structure of it. It is important in other contexts I shall be dealing with. The parietal cell, chief cells, etc. And these are the muscular cells. This is a beautiful diagram. Again, alamine. I am a fan of alamine. So look at the beautiful time that they have taken in drawing the diagram. This you can teach your students because you are no longer a student, you are a tutor also. So the lining epithelium, then the lamina propria with the blood vessels and so on. All these are made. Courtesy alamine. So this is the repeated history. Mucosa, submucosa, muscularis propria, and then subserosa and serosa. So muscularis mucosa is superficial. Muscularis propria means proper muscle, which will be the inner circular and the outer longitudinal. I hope things are clear to you. Gracias.